Hi, this is Dr. Susan Jaleo from the Biz Savvy Therapist, and I want to thank you for signing up for my new business models brainstorming information because I think as we start 2011, this is a really great and important time to start kind of rethinking how we do clinical practice for those of us that either work for ourselves or somebody else. At least in the United States, healthcare is going to be changing drastically over the next 5 years. And I live in Massachusetts, and so we're seeing a lot of those changes here in the state. And if you've read my blog for any period of time, you know that in September of 2010, my reimbursement rate decreased by over 11%. And I think that's what's going to happen nationwide as a country tries to increase the number of people that they give insurance to and decrease costs. I think the only way that we can decrease costs is if people make less money across the board. So I want to talk today briefly about two main reasons why I'm encouraging people to innovate in their practice models, and then I want to talk a little bit about why we're discussing business models to begin with. So the first thing I want to talk about is why innovate in your business. And the first is what I just mentioned, is that at least in the United States, the fee-for-service private practice model, whether you're a psychotherapist or a physician or another healthcare professional, is going to change drastically over time. And where healthcare is kind of progressing is into these larger group practices called accountable care organizations or medical homes, where hundreds of providers will work in basically one group setting with thousands and thousands of patients that they're all responsible for. And the insurance companies pays the accountable care organization one lump sum per patient. So the way that's going to work is that these are going to become big groups of providers. Providers will be salaried, and there'll be these big organizations that have to sort of negotiate care and sort of parse out who gets what care, how much it costs, and it's going to be sort of an actuarial exercise, and the providers are going to end up just being salaried. Now, for some people, that's very attractive because they don't have to worry about reimbursement rates and getting paid, and I absolutely can understand that as a provider, that can be very a relief to not have to worry about all that stuff. However, you're going to have very little control over what you get paid and how you get paid, and if the insurance companies decide to decrease what they pay, then your salary will go down, and et cetera, et cetera. So a lot of how you get paid will be out of your control. So those of us that want to stay in sort of more of a private practice model have to get pretty creative about how we're going to provide care. And I really think that there will be a relatively large group of people that are going to want more than what they can get out of their accountable care organization. I think that's really going to be kind of the Walmart of healthcare. It's going to be there, efficient. What you need is what, you get kind of the basics for what you pay for. And I think there's going to be a lot of folks out there that aren't going to get their needs met in terms of what they're used to in terms of healthcare under these big accountable care organizations. So I believe there will be room for private practices, for more of a concierge model. Again, I can't predict how that'll work specifically because it's all going to be evolving over time. And I think, in general, we'll try one model and then it'll shift and then it'll shift and then it'll shift and then it'll shift. And this is probably going to go on for a decade or so. So if you want to have more control over your career, kind of doing your own thing makes a whole lot of sense. And in order to do that, you really have to have your own business. So that's the reason number one that I really encourage people to be thinking about building a solid business. The second is sort of related to that, is that people want more than what they're probably going to get in these big accountable care organizations. And two, they really are going to need more than what we provide them. Even now, most people, whether you see them once a week or once a month or once every 6 months, depending on, what kind of work you do, they see you for a period of time, they walk out the door, and, I would say probably 80% of folks just sort of don't do much with what we've given them. They kind of like, oh, that was nice. I had a doctor's appointment or a therapist appointment, and I'll be back next week, and we'll go over that we just talked about again and see what happens. I think a lot of people can benefit from check-ins intermittently throughout their care. We can utilize technology now text messaging, email, social media, online video, online audio, all these different ways of giving people more information. And I think they'd be willing to pay for that. I think someone would be willing, let's say they were on a weight loss regimen, they'd be willing to pay a small monthly fee to have their counselor or their physician touch base with them in a really non-intrusive way, but on a consistent basis, to help them maintain their weight loss goals and keep them in the mode of taking action and not regress back to old bad habits. So I think that's a really exciting piece of all of this new technology for me, is that we have so many more opportunities to really do better treatment that's more intensive without our needing to be face-to-face with people all the time. So those are really two, there's many reasons why we need new business models. Those are my two kind of biggies of the reasons why I want to talk about it. Now, in terms of why business models to begin with, I think all of us, myself included, when we first start thinking about building a business, we want to get to the really exciting, sexy stuff. We want to get to the marketing. We want to get to our business cards, and we want to get to the fancy things that our website and our Google ads, and people are like ready to kind of get on out there and really drum up business. But the reality is, if you don't have a solid base for the reason of what you're doing, who you're trying to talk to, and what you're trying to get them to invest in, really all of that effort is pointless. So I see a lot of, not just in healthcare, but in small business in general, a lot of people hearing a lot of information from people online, reading blogs, getting information products, reading books about how to sort of, make a killing in small business. And the truth is, you really can do very well financially in small business utilizing online tools. But if you have no foundation, if you have no solid business model, you really, to use the old cliche, putting the cart before the horse. And so what happens is, and this happened to me to some extent, is I kind of started putting myself out into the world as a business person and not realizing that I didn't have a really good solid foundation. So I had to really back up and sit down and put my mind around, what is this business about? What need does it fill? Who is my ideal client or customer, and then how am I going to communicate my value to them? And so for me, I want the Biz Savvy Therapist to be a place where people get really what they need to build a thriving business. And I can tell you how to market. I can tell you how to use social media. I can tell you all these little all these levers and bells and whistles you can pull and blow and kind of get everything super exciting. But the reality is, if you don't have a solid business plan, then all of that is really for naught. Also, each person's business plan is very different from everybody else's. So, this program that I'm talking about, we're going to be building, it's going to be very customized. So this isn't going to be a program where you come and you listen to 5 lectures and I give you a worksheet and you go on your way. This is going to be a program where we have some interaction, you and I personally, as well as a small group of people that you bounce ideas off of, so that you can really develop a business plan that resonates with your goals, your skills, your passions, your strengths. And so it's really unique and something special in the world that people are going to want to invest in, that are going to want to spend their hard-earned money to work with you. So that's really why I'm passionate about innovative business models. It's not just about being innovative, it's not just about business, it's about having a whole model for your practice so that it benefits as many people as you possibly can, and you're able to really maximize your leverage in terms of reaching as many people as you can to make as much money as you can. So that's really all I wanted to say today. I'll be following up with a couple more videos, and I know a lot of you filled out the questionnaire, which I really appreciate. I'm going to be reading through those and seeing what people are looking for in terms of help with their business plans, and we'll just keep having a conversation. So if you have any questions about this or want to leave any comments, you can below in the comments section below here. And like I said, let's just keep talking and see if we can help you build a great, thriving business in 2011. This has been Susan Gerleo of the Biz Savvy Therapist.